Yeah, so once again, good afternoon to all of you. My study is all about assistive technology. So I feel my study will have a lot of impact in Ministry of Health, National Program for Control of Blindness, and Ministry of Social Justice Empowerment. So when you say assistive technology, so it can be from the very low locally production, like a simple walking stick, up to the very high-tech modern technology. So it doesn't mean that assistive technology means it's like very high-tech, very expensive. So simple walking stick can be assistive technology. So before I start this study, so the most confusion is how to classify the assistive technology. So in the context of visual impairments, so WHO doesn't have any classification. There are so many classifications when you do literacy review: wearable, portable, visual substitution, visual enhancement. There's so many difficult things. So that's why what I do is I went to the schools for the blind in Delhi and visit those schools and talk with the children, students, and interact with the principals, head teachers, and observe the students' activities. So what sort of activities, what sort of reading medium they use, what sort of writing medium they use. So once I observe, after visiting 3-4 blind schools for the blind in Delhi, so I concluded the assistive technology can be classified as reading, writing, mobility, math, science, activity of daily living, and sports. So this is a kind of sub-center of my main research study, so it has been published in somewhere else. So coming to the background, in Delhi there are 24 blind schools. Out of this, in these blind schools, so most of them, belongs to non-governmental. So government has only one blind school in Delhi. So, and most of the schools, they are residential in type. So student has to there in the school itself. As per the Government of India guidelines, so 40% of the, if someone is having a 40% disability, so they can seek for the admission in this blind school. So in 2 studies, it was supported. See, around 30% of students, have a functional vision. The rational, students has a lot of challenge, while reading for education activities. That's why you have to do what are the available assistive technology in these schools, and the teachers train manpower in this school for the blind. So objective, as I said, availability of the assistive technology in these schools for the blind, and along with the trained manpower, special educator. So methods is the simple cross-sectional studies. Out of these 24 blind schools, 10 has been selected randomly, and the study participants were the school head teachers, the principals. So as I mentioned, so this assistive device is being divided into 7 domains: reading, writing, maths, science, games, mobility, and activity of daily living. So there are 51 assistive devices. It has been divided. Again, this reading is divided again into the visual base and the tactile base. So I use the pictorial booklets because many of the assistive technology, they don't aware. So I use the pictorial, books. So in the side, so you will find the pictorial representation of the assistive device. So data collections done by the researchers and by optometrists. And results, out of this 51 assistive device, assistive technology, so 15 has, availability are there in 7 schools. I mean, say good availability. So out of this 51, only 15 assistive technology are in 7 or more schools out of this 10. And most of them are, visual based. So when you're coming to the results, so here's reading, writing, mathematics, science, mobility, games, and living. So here, so you'll find here this is a visual base. This large print book on optical magnifier is a visual base. And braille reading book, this is the tactile. So the student has to use tactile, some touch technique. And similarly, audio format, audio material, this is a tactile base. And those all braille books are the tactile. And some of the, most of them, in the schools available are the tactile base. And this visual base, in terms of magnifier, near, distance, they're hardly available in these schools. So about a trainer, so total trainer is, special educator is 38. And about the mobility trainer, maths teacher, and science teacher in these 10 schools is very low in number. Discussion now. So in these schools, as I told you, most of the device out of these 51s, they belongs to a tactile base. Visual based assistive device in terms of those large print books, magnifier, it's not available adequately. So that's why those students who have some visual function, so they're supposed to use this, visual based assistive devices. And teachers, again, why teacher is so many in special educator? Because in Delhi there is a Jamia Millia Islamia. It provides special education. There's called B.Ed and masters in special education and mobility trainer. Because there are very few mobility trainer in these schools for the blind in Delhi. Because this NIBIS, so NIBIS Dehradun, the National Institute for basically visually handicapped. So here, this is the only institute that provides a mobility trainer, orientation and mobility trainer. That's why in most of the schools in Delhi, so there are very few mobility trainer. Now recommendation, the school's authorities should make availability of all range of assistive device in terms of visual base and tactile base, and students who have usable visual function. So as I told you, in many research, it has been already ruled out that 30% of the students, they have a visual function. So they should be able to use this. And trainer also, the school should provide the visual trainer. Thank you. Okay.
And then result will be declared by the office, chairman scientific. So just to speak, last speaker. Any problem?
There is some system error.
We correct already. Previous sessions penalty we are using. Dear audience, it is my record in the last 10 years. I never exceed my session for a minute even.